Hello and welcome to today's webinar, Unify Member Operations and Engagement to Improve Experience and Performance. Before we get started, I'd like to review a few housekeeping details. Today's webinar is being recorded and an online archive of today's event will be available within 1 to 2 business days. If you have trouble seeing the slides at any time during the presentation, please press F5 to refresh your screen on a PC or Command R if you're using a Mac. You may ask a question at any time during the presentation by typing your question into the Q&A box located on the right of your screen and pressing enter. And finally, I'd like to remind you of AHIP's antitrust statement located in the link just below the slide viewer. We will, as always, comply with that statement. Among other things, the antitrust statement prohibits us from discussing competitively sensitive information. And we're very fortunate to have with us today Tom Cohen, Executive Vice President at Softheon, and Harlan Edlin, President at Novillus. And at this time, I'd like to turn the floor over to our first speaker, Tom.
Well, thank you very much, Joanne, and thanks to AHIP for having us. Really excited about today's discussion. So just some quick introductions here, and again, appreciate the chance to talk about this very important topic. So I'm Tom Cohen. I'm Executive Vice President here at Softheon. I've spent the better part of the last 12 years focused on consumer experience solutions as well as back office solutions for health plans, and looking forward to guiding us through today's call. Harlan?
Thanks, Tom, and I second that. Thank you, AHIP, for having us this afternoon, this morning, depending on where you're at. I'm Harlan Edlin, President of Novillus. We have offices in Portland, Oregon, which is where I'm out of today. And like Tom, I've spent the better part of a decade focused on digital health solutions, both on the payer and the provider side, helping members connect to care in various means. And I'm just really excited for today's discussion.
Yeah, it's funny. Harlan and I were both at the AHIP Institute last week, and if any of you listeners were there, you probably got to hear plenty about this topic. There's a lot of focus on how can we unify operations, how can we build better experiences for those members and prospective members and patients, and ultimately how do we improve our plan's performance. So we're going to dig into a lot of those elements today, really looking forward to a chance to share each of the respective stakeholders' positions. So Harlan and I will do a nice balance of not only those prospective members, but we'll also hone in on what it looks like as people move through that entire workflow and turn into both members and patients, and then think about your staff as well, who may be interacting with your entire ecosystem, whether it be distribution or your provider network. So let's dig in. So in terms of where we start, I thought it'd be a nice reminder for all of us. I know that we all live in this world, and it's easy to lose sight of how complex what we deal with is on a day-to-day basis. And I know it gets stated often, but what we don't often do is zoom out and really kind of look at the entire space around us. There's a lot for us to navigate when we're working with our members and all of those other stakeholders that play a part in this. And that first part of it is the regulation. So, you're dealing with a balance of multiple entities that set rules and set guidelines for how you and your teams have to operate. And then in addition to that, you have to balance different types of populations that vary from young and old and impoverished or below poverty line, and then affluent. And in addition to all of that, you have to navigate things like MLR, technology updates and costs, changing markets and expansion, and managing all the programs that might touch your members or your patients. So a lot for all of you guys to manage on a day-to-day basis.
I couldn't agree more, Tom. And if you look back even just a handful of years on the regulation side, thinking about transparency and coverage or the Real Health Providers Act or the No Surprises Act, there's this constant evolution and sort of deadlines looming for things that your organization has to do, often around enterprise data management and accessibility to meet those regulatory compliance deadlines. Not to mention on the Medicare side, sort of the ever-changing goalposts with your CMS star ratings and what goes into that, which is a direct tie into how you're managing your population's health and wellness and access to care. And and driving that wellness back into the metrics that you're tracking at a health plan, because ultimately we're seeing so many use cases around running a sustainable business in these changing goalposts and in this regulatory environment with the health plan space, that data interoperability and uniformity across your enterprise to drive member engagement is becoming just absolutely critical for our health plan partners and customers to thrive.
Agreed. So let's jump into a first poll. Harlan and I thought it'd be a nice place to start, get a little bit of feedback, make this interactive up front. So let's go ahead and jump into that.
Yeah, absolutely. So we're curious today in today's session, as you're coming into it, or maybe in the past several months, as you're thinking about your health plan, how do you view complexity? How do you view complexity affecting your experience, but also your ability to execute an experience for your membership and your population? Are you going into it with, oh my gosh, we have so much work to do, it's overwhelming just to get started? Hey, we're doing better, we got started, but we've still got work to do. Or yeah, we're doing pretty good. We give ourselves at least a B grade, or you know what, we think we're better than most. Very curious what the audience, we've got a packed house today, what the audience thinks about their own organization and how complexity is affecting your ability to deliver a good experience to your membership. All right, we're watching them roll in, and as you can imagine, there is certainly a trend towards we've got a lot of work to do.
Yeah.
Which is no surprise. Tom, I don't know, like you said, the takeaway from the AHIP Institute last week is there is a lot of work to be done, and the data landscape is changing more rapidly than any of us have ever experienced in our lifetimes. Consumer expectations going up, data, large language models and data, enterprise data management is changing rapidly. It's no surprise that we have a lot of work to do as an industry.
Yes, and I think, interesting tying to this, the funny thing that I find about that poll is that 0 people put we're doing okay. Everyone either felt like they put some effort into this and they're better than most, or they either have a lot of work to do, or they're they're in a spot where they know that they're getting better but not there yet. So adding to this complexity, is not only the blurred lines between lines of business. This is a small example of the interplay between individual products. So it's just one little microcosm, but equally or potentially even more important related to the experiences delivered can be the underlying data and how that data is utilized and in a fashion to impact operations, experiences, and engagement. So this is just a small snippet, but you might see in a matter of a handful of months, several of you, a member that is in a Medicaid plan, then they get redetermined, then they might bounce into your ACA marketplace business, and then they may move into your Medicare business as they age in. With each of those movements, though, comes this element of data. And Harlan and I, as we were preparing for this, we were kind of chuckling about just how complex it can get, the picture can get when it comes to the data, let alone the experiences that you have to deliver for a member when you're dealing with this type of interchange.
Absolutely, and something that we're seeing across the board with all of our customers is a shift away from individual sort of relationships on the line of business level to the member, to really an underlying data model that supports a golden record or a golden member ID, so that as a human who's interacting with a brand, I can trust that whether I'm moving from this line of business to that line of business, I am having a cohesive experience. And then on the back end of that, from the health plan's perspective, the Medicare KPIs and targets for the year from a performance perspective are very different than ACA, than Medicaid. Sure that there's a comprehensive data strategy to hit the KPIs and performance metrics that your line of business is targeting, which often are very siloed at our health plan partners, but making sure that they're working together both collaboratively as an organization, but also from a data perspective to ensure that they're tracking and optimizing that member's journey. And like you said, Tom, really personalizing it on top of that. That's just a bonus for sure.
Yeah. Well, speaking of personal, I thought I'd take today's journey on a little bit of a personal level. So I'm the father of 3 boys and have had the pleasure of coaching all of those boys in basketball. And I think most folks in the world of basketball understand what it looks like when you're coaching young children in the ages of 5 to 7 years old. It generally forms an amoeba around the basketball and just kind of moves in one cohesive unit, which is not effective approaches. So as we look at the journey and how folks can really start to unify their operations and to course correct to get to a place where they start seeing efficiency gains and they can improve the experiences that not only the member has, but their internal teams as well. So as we move through this today, I'm gonna bestow upon everybody here a little bit of basketball analogies. So one of the things that's really important as you start thinking about the noise that takes place in the background, you may have coaches that are out there yelling at your kids, trying to get them to not follow just the basketball. You've got a parent that's yelling at a kid to shoot it because they want to see their kid score. So how do you make sense of, in the midst of all of that noise, how do we get to a place where ultimately we start seeing some semblance of structure and something that looks like what resembles real basketball? So a couple of areas, in terms of setting ourselves up and introducing structure and practices that ultimately can improve the outcomes that are being delivered. And I like to think about this in a couple of different ways. So first is just empowering the players, if you will, with guidance about what they should be thinking about big picture wise. And Harlan, you've been really close to this. I know you specialize in product for a lot of your background, but how do we start empowering individuals and start kind of changing the way that we're thinking about guidance and what sort of ecosystem we should be trying to create internally?
Absolutely. It really is a challenging moment for healthcare as a whole, because the consumer expectation historically has been on the rise. Now it's going off the charts more rapidly than ever in terms of how much is being personalized by AI on your phone and all the interactions that you're having throughout your digital ecosystem. And healthcare has historically dragged behind personalization. It's now moved from a nice to have, or maybe we're doing better than most, to table stakes, right? It's a complex topic. It's an on-demand topic. You can't predict when you need to consume healthcare all of the time. It often comes at you rather abruptly. So making sure that there is a partnership between, your healthcare journey and your membership's healthcare journey, and the guidance that you're putting in front of them. Look, we all have tons of resources at our health plan partners, from care coordination to historical claims information on how we can personalize, the consumer journey through health. But they're often underutilized at our health plans, either because they're siloed. Look at the value-based models, right? Outcomes-based models. It's a win-win-win for everybody, the payer, the provider, and the consumer, but lack of access to data doesn't enable the ability to personalize the consumer journey in that end user experience, however they're accessing, that guidance through an app or through your website or even just text messages. Pushing that all the way back through the provider's experience, the provider that they trust, that they're going to see, and making sure that that's aligned with the payer's performance metrics around each program. So the data exists, the models to personalize that data exist. It really is an exercise of unifying that, operations and data strategy within the health plan to make sure that it all comes together to make the next best action on the member level, the next best action for them to drive health and wellness and the best clinical outcome, and also be in line with whatever programs that they're a part of within the line of business that they're enrolled in.
Yeah, and before we
And there's
transition,
some,
I do just want to call out. I was just going to say, I think it's interesting as we think about guidance and how we can interact with our own teams. We have to be mindful, like Harlan said, of how can we leverage data? How can we start leveraging personalization? And that looks different. I do just want to call out for folks, even just again, to use the individual marketplace as a frame of reference. The under and over 65 populations look drastically different. So if we're thinking about guidance for unification of operations, there's not a whole lot of leeway for product differentiation in the marketplace. Whereas Medicare, the sky's the limit. You can create as rich of benefits as you want in Medicare Advantage plans. Whereas your product and operational teams have different structures in marketplace. So taking those factors into consideration is certainly one thing that has to be weighed in.
Yeah, one good example of a Medicare plan that's doing this really well is that they have constructed a model for their either highest risk or at risk of becoming a highest risk patients or members, and come up with really a benefit structure that allows them to utilize the benefits in a personalized way. And what they're doing is they're connecting the dots between, hey, we know these are our at-risk population in this Medicare plan. We know that these are the providers that they're attributed to, and they are prioritizing those the members, and partnering with the providers to say, we actually want to synchronize your scheduling, not our scheduling, not the health plan scheduling, the provider scheduling experience with the most important patients from both a chronic condition perspective and that are high risk for our health plan, and make sure that you as the provider know who's coming in, and if there's anything that we're aware of that you need to talk to them about, that you have that in front of you. And B, if they're not already scheduled to come in, that we can help guide you towards the right patients to drive your outreach towards. So that's guidance right there. And it's a great example of partnering with providers to get to the right patients, both that are already inbound or that need to be inbound, and personalizing that experience based on their actual condition count or condition type.
Yeah, and I love that you started to touch on this, right? The communication and how key that is. I know you have a ton of stories around communication, personalization. I think we limited it to just 2, but I would love for you to share a couple of those stories with the audience.
Absolutely, yeah. I mean, it's funny because we tend to, back to the theme of complexity, we tend to complexify guidance, personalization, access to care, right? At the end of the day, it's about communicating with people like you and me who need something at a certain time, at a moment in time. And we're all communicating all the time, as we know, in this day and age, with constant messages and things going back and forth. But the health plan communication channels can often be so fragmented. We had a customer health plan that they'd gone out, and they were best intentions. We want to communicate with our members effectively. We want to make sure that they know what the next best action is. So they went, and unbeknownst to the 3 different groups, you had digital, you had marketing, and then you had line of business specific messaging. They went out, they got a vendor, a communications vendor. We're doing HIPAA compliant messaging to their membership. In retrospect, fast forward 12 months, they were doing a retrospective with their teams, and came to find out that they had accidentally overlapped and sent over 300 messages to one member across these 3 different channels. And if you're on the receiving end of that, you can imagine you just completely don't trust the messages coming in. There's too many, 1. They're completely disjointed, 2. And it's pretty obnoxious, I would say, to be getting that many messages. It makes the brand look foolish. So that would be an example of the, sort of the opposite of what we just discussed, where we're aligning schedules and we're prepping providers for conversations, and we're doing the outreach to say, hey, we know you're an X health plan member with Y benefits. We want to get you into the clinic. We'll pick up your Uber or whatever the enhanced personalized benefit is. That's one end of the spectrum. The other end is I'm just being bombarded with messages that are disjointed, and I'm eroding trust as a member. And Tom, I know that's something you guys see a lot as well. on the member experience and how to communicate with members where they're at the moment.
Yes, the at the moment thing is an important one, and I would just call out, this is actually one of my customers, and she leads an enrollment and billing team, and she was talking about the fact that her husband, anytime she gets a piece of mail from the health plan and it's titled Cheryl, she puts it in a big pile, and at the end of the year, she looks at all this communication and says, I don't like being referred to ever as Cheryl. That's not the name that I go by. It's not my preference. And I know that this is some sort of official documentation that doesn't have anything to do with where I'm wanting to be met. And, those are great examples of where we have opportunities, both, individually, but as an organization, to say, how do we meet this member more where they are? And I had a personal experience, where I would say that I would call a foul. And back to the basketball analogy here, it's not a situation where you are going to be spreading the best of news about your health plan. And my situation was that my wife was on a fun trip with my mom and my sister. And on her way back to the airport to fly home, she went into tachycardia. And she called me to tell me that she was, that she was freaking out because her heart was going crazy. And as somebody who had had an ablation when I was 29 years old, arrhythmia was not something that was abnormal to me. So I was explaining to her, I understand the feeling that you're going through, tried to calm her down. And I said, well, go get you looked at when you land at the airport at home. And I quickly went to, having been in the consumer experience space and in the health plan shopping world, I quickly went to my health plan's shopping solution and tried to find an urgent care that had EKG capabilities. And it was near impossible. And this is somebody who had been in the industry for a decade, dealing specifically with these tools. And their tool was not straightforward enough for me to be able to figure it out with their online solution. So then I called customer service and, asked them for exactly what I was looking for. And they said, well, I can't tell you whether or not they have any of the equipment that would be necessary to do an evaluation for tachycardia or anything like that. And it screamed at me, we get frustrated when we work in the health plan space. We get frustrated when we see avoidable emergency room department visits. But then in a situation like this, it often is not a facet of a member not wanting to try to use a different alternative, but it's a lack of ability to meet them in the moment. And, I would call those fouls. And so this is that opportunity to present those types of guided experiences, and for us to think about which types of situations that we want to avoid as a health plan, and avoidable ED is at the top of almost everybody's list. How do we present guided experiences that eliminate that? We should be thinking about our consumer experience for provider search and for our shopping tools that allow people to know, is my drug covered? Is this type of service available at these facilities? These are things that I know often get taken for granted, and they are complex behind the scenes, but we have to be able to get that more right than wrong. And the last thing that I would just call out here is I recognize, the challenge of regulatory burdens that all of us face. But at the same time, we're getting to a place where we should be able to leverage tools that enable us to, like Harlan called out, there are HIPAA compliant communication solutions out there. How can we meet that member in the moment and ensure that we are delivering a better experience for them when they need care and when they want to take advantage of it? And I'm sure Harlan was one of the people that I immediately after this experience, I reached out to and said, man, I'm really upset with my health plan. And that's not the type of thing that any people in a health plan want to hear, but inevitably it's more what happens. It's the things that go wrong are the things that get shared. You don't hear about any common foul that happens in a basketball game. You hear about the guy that got ejected from a game because he had a really bad technical foul or he did something stupid. And we're operating in kind of the same capacity here in our health plan ecosystem. So how do we then, now we've got some of these, we've set the stage. What are the things that we have to do? I always like to think about it that we've taught the drills to the kids. We've put in place proper shooting form. Well, now we need them to go out and practice it on their own. But how do we get there? So I thought maybe a good opportunity for us to dig into some very specific ways for us to deploy these sorts of solutions in our respective environments. So 3 key buckets that I'm going to focus on, and I'm sure Harlan's going to have plenty of additional things to add here, but the first is expertise. Regardless of whether that expertise is internal and making sure that you have appropriate subject matter experts that are focused on the types of things that impact operations and that impact member experiences, or whether it's external consultants that you're relying on or a vendor partner. Regardless of who it is, you need to know where your expertise is coming from. The second is that adaptability and configurability. This is taking that big picture view. If you move into solutioning or into technology, but that technology isn't adaptable or isn't going to be configurable to play well with the rest of your environment that you have that you can't replace, if things don't integrate well with your core admin systems, with your general ledgers, with any other core tools like CRM, you're going to be in a really bad spot at the end of the day. The third really key category is the financial piece. And all of us know dollars, probably more today than they have in the last 2 or 3 years, matter more. And how are the changes that you're making around infrastructure and operations, as well as member experiences, going to deliver the results that you want financially, whether it be that you're trying to lower the call volume into customer service teams, if you're increasing your membership by growing geographically or growing lines of business, or if you're chasing administrative cost reductions by consolidating vendors. Make sure that you're documenting and quantifying where the ROI is that you're going to deliver as you think about that unification of your operations and how you can deliver better experiences for both your members, patients, and or internal staff.
Absolutely. We're seeing across the board right now, starting with ROI, all hands on deck. You know, the changing goalposts around the CMS star ratings that came out pre recalculation for 24 and 25 was really sort of a wake-up call that ROI and sustainability around plan profitability is an entire enterprise problem. It's not just government affairs or revenue integrity up in that other building on campus or virtually. It is around the whole organization, and that comes from shopping, perspective, converted to enrolled, retention through that enrollment, all the way to benefit utilization and into the clinic and actually utilizing their health plan benefits to become healthier people. Making sure that journey is mapping back to the ROI is sort of everything right now. And every conference that I'm going to and conversations with health plan leaders that we're having is in that vein of creating that sustainability and plan profitability while also taking care of the memberships and through the providers as well.
Yeah, and then I would say the next thing for you to think about is integration. And being intentional about integration is really, really critical. And one of the things that Softheon took to heart as we approached this industry and taking on this idea of how do we simplify things for our health plan partners. And we really wanted to reduce the operational burdens that were borne by our customers. And part of the way that we've done that is by being the primary interface for data with CMS or any state-based exchanges, in addition to those upstream merchant partners or fulfillment partners. This way we can distill down and normalize any of that data into those core systems that are really, really crucial for our health plan partners. So whether it means that we're integrating with a core claim system or a CRM or a general ledger, we want to remove a lot of those burdens and ensure that the integration points that are taking place between these solutions and the data points that ultimately matter to the health plan, that we're making that as simple as possible. And that unification for us is something that we take really seriously and that we're very intentional about. And I know, Harlan, you guys are the exact same.
Absolutely. I mean, we all talk about interoperability and data exchanges, and what you guys are doing is making it real. It's bringing it to life. And as cliche as it sounds, that interoperability and those data streams and mechanisms is how we drive outcomes. Define outcomes how you will, clinical, financial, and otherwise. But access to that information across the health plan, and then into the provider experience and into the member experience or the patient experience is how we're driving that engagement. At Novillus, we see this all the time. Our particular corner of the world helps our health plan clients, partners, unlock all of the programs for the providers, right? So we are the payer provider sort of engine, and then those providers take all of that customized, personalized information to engage the membership, the patients, the chronically ill, the at risk of becoming chronically ill. The annual wellness visits, ever important to get those AWVs in as well, and really unlocking that personalized journey for the members. But again, it all comes back to that data interoperability, not to be about the buzzword because it is incredibly overused, but those unified data exchanges and those cross-functional teams that are helping your network teams and your Medicare teams or your Medicaid teams work together to bring the personalized experience for the providers and help them understand how to engage those patients is everything for getting them engaged and getting them in clinic. And one of the ways that we're seeing, one of the major trends, I would say almost without fail, every conversation that we're having in health plans right now is bringing what historically was very siloed quality experiences, or the risk adjustment experiences, or the financial incentives or value-based experiences from a health plan that were team number 1, team number 2 and 3, team number 4, and bringing them together into one experience to engage the providers. We have a big belief that the providers are at the sort of center of the universe, and that the health plans and the patients come together in that provider ecosystem, because as a patient you trust your provider, and that's who you're interacting with sort of in a physical or virtual way most often. And as a payer, you have so much information to equip, or not, but hopefully equip your providers with what you need from them from an engagement and performance perspective to get the right patients in at the right time. And if you look at that sort of end to end, you go back to your data exchanges, Tom, that Softheon's so equipped to do. It is about unifying that operations and data flow so that we can drive that engagement.
All right, so let's round the corner here and let's talk about, if we're thinking through business case, and ultimately how does this impact the bottom line. And Harlan, you and I have spoken a lot over the last handful of years, whether in collaboration or just as peers in the industry, about business impacts and how important it is for these things to be kept in perspective. Let's just talk through a little bit of these specific areas of performance and how ultimately they tie together, and where, if a plan is able to adjust accordingly their experience or their operational savviness or efficiency, what does that impact look like on the business side?
Yeah, I mean, you really do. To get a comprehensive view, you have to look at it from end to end, prospective member to converted member. How are we going to retain that member? And put the actual, if we're talking about business case, put a dollar value in terms of where that member sits in your financial ecosystem as they go from prospective to converted to in clinic to any intervention, care coordination after that. And you've got a really interesting couple of points on this particular business case, which I like a lot, in terms of renewals, churn, and payments. Because consuming healthcare, engaging with the healthcare system is one thing, but if I'm struggling even on how to easily pay my premiums or deductibles, that's equally as frustrating and can be a huge detractor from an experience perspective for consumers. So if you're looking at it from an end-to-end perspective, Tom, I know you've got some great examples on how to drive higher conversion from prospective members, and then how to keep those members around for as long as they need to be within your line of business. You can talk about that, but then that downstream impact on your risk and quality programs, which have huge financial implications on rebates and lowering the MLR, or the cost of care, or any bonuses involved, understanding where that member came from, their historical journey on how they got to where they were meeting you and then getting in clinic is a huge component for building a business case.
Yeah, and what I find interesting about this is that if you look across the left and the areas of performance, one of the things that I often challenge our customers on is how frequently are all of those stakeholders from each of these respective rows brought to a table together? Because the reality is, if you're handling upstream digital experiences, those are ultimately going to impact risk and quality down the road. And similarly, if you're handling payments and transactions, those are going to directly affect retention, and that is probably going to even pull in teams that might not be represented on the left hand side in sales and customer service. So the challenge often that we see is these silos that might get created internally. And part of what Harlan and I really wanted to make sure that folks understood here is you're not taking a holistic picture and understanding the business impacts at each of these respective phases and how they all play into each other. You're doing your plans a disservice. And so this is just one thing to keep in mind as you're laying out strategies and as you think about what sorts of people do we want in the room as we're talking about decisions or things that we want to shore up. The last piece, and I would say, back to our basketball analogy, if you want to create championship teams or create, situations where you are as set up for success as you possibly can be, this idea of personalization, I think, is one where if you can nail that, you're ultimately going to have member acquisition and competitive advantages in the market. Tailored benefits will ensure that you're attracting the members you want and have the components in place to deliver unified operational experiences and support that will drive up that satisfaction and retention. The proactive communication, if you can deliver that in an effective manner, will bring back to you responsiveness both internally and externally. And then real-time insights ultimately that can help your team stay nimble and hyper-aware whether their approach is working or not. I would say or not is equally important so that they can adjust quickly. I always like to talk about this one in terms of fail fast and fail well. It really leads to eliminating waste. So all of these things combined in an equation ultimately lead to a situation where you're going to have much more success and you're going to see the business impacts that we had on that prior slide. So we're rounding toward the finish line here. Harlan, let's do one more poll. I'm curious to hear from the group on this one.
Let's do it. Awesome. So now that you've sort of had some time to process and think, how are you guys experiencing or improving your member experiences? Curious where the polls are going to come in. We will open up the poll. Guidance and shopping, or access to care, self-service and member portals or apps is a huge sort of part of the recipe. Personalizing those communications. Who's using AI-powered plan design? That would be a really fascinating one.
Interesting. I'm seeing other pop up so far as one of the leaders. Guided shopping, quality and risk tools. All right. There we go. Now care scheduling is catching up.
Yep.
Quality and risk tools is a pretty significant one too. All right, we'll give you guys about 5 more seconds. I know there's a lot of check boxes for this one, but we were trying to be holistic, and we know that there's a really disparate group of folks that are out there in this particular webinar. So excited to see the finished results, and I think we've got those in. All right.
Mm-hmm.
So guided shopping, care scheduling, and quality and risk tools all tied for the top spot, with the exception of other, but other's really hard for us to know exactly where that was. But interesting. Harlan, what do you make of that?
Oh, it's right in line with what we heard last week and what we heard even previously at other events like Health Evolution events, where you have to connect the ecosystem from shopping to care access. And that is such a direct correlation to the risk and quality programs, which we know are driving, really steering the health plan's performance these days. In some ways, I'm not surprised. I'm actually sort of pleasantly surprised, I guess, if you will, on those top three. One quick call out that I think is really interesting, having been in this space for a bit, is that chatbots got like nothing, and there was this moment where chatbots were sort of taking over the world, and now they've been completely demoted outside, and we're really focusing on arguably the most important things. Tom, what's your take?
Yeah, I agree. I think it's really intriguing, the balance I think that we're seeing here. I do feel like we got some representation from the digital audience, or the digitally focused teams, because the idea of guided shopping certainly got some votes. So a good balance of folks. But I think this, especially right now, this focus on quality and risk and how important it is probably a solid reflection of the new CMS final rule. And I have to imagine that a lot of folks are trying to figure out, how do we ensure that we're not going to lose revenue in these Medicare lines of business that have been successful for us for the past several years. But now, as you pointed out earlier, the goalposts are moving a little bit, and maybe even moving back in a different way for reevaluation for this year. But yeah, it's a nice little microcosm of what we saw. So I think one kind of final thought, and this is just, it was a funny kind of anecdote just about our organization's maturation process in this same area around unifying operations. And, you know, if I look back nearly 10 years ago when Softheon first was created, we were really focused on just supporting health plans, not only, you know, with providing state-based exchanges, but then also supporting all those health plans who were participating on the marketplace once the ACA was launched. And our focus or emphasis was purely on that ACA and primarily on exchange. And a lot of emphasis was put from our customers on, hey, we'd really prefer to have one solution for all things marketplace. So, you know, medical, dental, vision, anything that, you know, that they're offering on the individual under 65 space. And then go back to 3 or 4 years ago, ICHRA gets launched. And then that provides us another opportunity. And our customers are coming to us and saying, we would like to not go to a different solution to help facilitate ICHRA benefits. Then you have, in the last case, you know, Medicare Advantage. One of our plan customers came to us 2 years ago and said, we want to launch a Medicare Advantage solution, and why would we use a different solution for over 65 when we're using you guys for all of our under 65? So this has spurred us, and I think, you know, from our view, we've had to take some of the same medicine and realize, hey, we really should be thinking more about how we can help unify operations. And we've been able to do that, I would say, over the last 4 or 5 years in a more strategic and thoughtful way to provide one solution that covers all of those disparate lines of business for under and over 65 populations. All right, so we're at the favorite part of the presentation, which is the Q&A. So please, if you haven't and you are interested in posting questions, I know we have a few that have already shown up there, but please feel free to post your questions into the chat. And Harlan, I think there was already one that you had flagged that you wanted to take on. So you want to jump into that one first?
Absolutely. Yeah, we've got a question here. What type of jobs roles exist in our industry that can help payers and providers collaborate so that patients or the consumers don't suffer? I love that question because it's just so right in the vein of everything that we're seeing today. Just anecdotally, when, you know, that's really the core of what we do, is helping our payers enable the providers to be targeted and be personalized with their patient panel and prioritizing that patient panel. So there's two things that we see very consistently with our health plan partners. One is the need to be cross-functional. So we often see, you know, network management or provider engagement teams at the table with the risk team, and then the quality team, all coming literally in the same room, steering committee style, to talk about, here's the risk, you know, stakeholders program, here's the quality stakeholders program, or revenue integrity, or government affairs. How are we actually interacting with the provider network? Are we doing monthly in-person visits? That's a very common part of the formula. Let's make sure that we're getting out there and that we're prioritizing. Are we doing additional virtual support or helping them understand or walking them through kind of the different levels. One of the other great examples that we've seen is making sure that there's executive alignment based on maybe CFOs or chief Medicare officers or executives coming together at the health plan and the provider groups to look at the technology, whatever technology you're using, and say, this is our program, this is how it works, walking them through. But then also a second tier of meetings happening kind of continuously to make sure that the data flow is being accurate. So steering committees, executive alignment are critical. Training on the platforms that you guys are using for your payer provider enablement. And then lastly, just making sure that you're working with and getting feedback from the providers to understand how they actually want to work, not just telling them how you want them to work. That's a really, really critical component of the provider network engagement teams to drive success across your programs and lines of business.
Yeah, it's interesting. And I think back to when I first worked in a health plan roughly 11 years ago. And I remember the only people that really had a whole lot of interaction with the provider community were people that were in what were called provider relations. And I think that's one of the first things that, as we look at this ecosystem, every organization needs to think about what sorts of roles set them up for the most success. And it may not be those more traditional roles. So creating roles that are dedicated specifically to whether it's representation for the provider community or technology for the provider community. There's a lot of different ways that folks can think about the types of roles that put them in a position for success with this critically important part of their network or their ecosystem. All right, so I think we're going to do one more question. I think the other one that I saw pop in was, what do you think is the easiest thing payers could do to improve member experience that they're not doing today? So this one's near and dear to my heart. And what I think is interesting about this question is I feel like a lot of folks would look at me as someone who focuses on some of the consumer experiences and has focused on software for quite a long time, to come to you and say, oh, there's one gadget that everybody has to have. And frankly, I don't think that's it. I think a lot of times what's happening right now in terms of member experiences is folks aren't making it simple. Most people simply want solutions that work. And yes, there's an upside of all of the incredible new technology is out there. And I think AI absolutely has to be utilized in some way, shape, or form. But I think doing that in small doses and doing it in a calculated manner with small and simple is really important. And then the last piece that I would call out, and this is not necessarily just the one thing that they could do, but I would say more a philosophy. Being in a position to incorporate and utilize APIs is something that I still think a good chunk of health plans are lagging behind on. And regardless of how awesome of a member experience you want to create, if your infrastructure is not set up well to work with new age technologies that are leveraging all of the newest technology as it pertains to APIs, and in Harlan's world, there are a lot of new mechanisms for patient data to be shared. But this is a good example of you have to get the basics right, and data is at the foundation of that. So if you aren't capable of utilizing standard API frameworks or ingesting data from partners in your ecosystem, you're going to be in a difficult spot to create good experiences because the underlying data will be weak. So that would be my advice with relation to that question. There's not a gadget or a gadget or a vendor that I would say that you have to go and leverage. But I really do think that having those core building blocks and keeping that core principle of keeping it simple is where you'll see market improvement. All right, I think that'll do it. Joanne, you want to close us out?
Great. Well, thank you so much, speakers, for sharing your thoughts today and for that great presentation. And thank you to the audience for participating in today's webinar. This concludes today's presentation. Thank you again and enjoy the rest of your day.